So clinic letters created in CubeScribe are now available within EPR, and this short video is just to show you how best to access them and filter them to make it most useful. So the letters are available in 3 places. They're available in clinical notes. This is a bit clunky because you have to double click here, go into medical, and then you can filter down into cardiology or renal or whichever letters are available. And if you double click one of these, this blue link will take you into the letter itself. So that's not ideal because there's a few too many clicks. Just so you know, if you go to results review, you can also see the letters. If you scroll down here, they will appear down here, and you can scroll across to the left and find those letters. And again, if you double click on this, it'll take you to that link, the blue link, which you can click and take you into the letter itself. It's worth bearing in mind that all the letters created in CubeScribe, going back as far as 2012 when the first specialties went live, are now in EPR, but they were all loaded in February, the middle to the end of February, so you'll see these letters all appear at the same time around February. Going forwards, whenever you authorize a letter, it will appear in EPR immediately. It gets authorized, and therefore the dates will be relevant, whereas these are all historic, and that might cause a little bit of confusion, but that will become less of an issue going forwards, I hope. So I think the most useful place to look at all this is under clinical documentation, and here there's a huge amount of various documents. Anything created within EPR itself will appear directly within this pane, but we're interested in clinic letters here and don't really want, if we're sitting in outpatients, to see all this stuff, most of which has been created on an inpatient record. It's worth noting that X-ray results are available here. Again, these have been created within EPR. There's a chest X-ray report here, so that's all available. But I think to make this useful, we really want to be able to filter it. At the moment we are seeing everything. If you click on these 3 little dots, one of the most useful aspects of this is that we can filter for just the documents we want. So if I'm sitting in outpatients, I probably just want clinic letters, and I may want just my own clinic letters or just my own specialty, or I may want clinic letters from every specialty. So first of all, we're going to just set the filter to set all clinic letters so I can see other people's information. So if I click on the plus sign by clinical documents, if I scroll down to medical, and if I just tick in medical, that will give me all the CubeScribe clinic letters. So I'm going to save that as outpatient letters and apply that, and you'll see here it's gone from that vast amount of data to just, this patient only has cardiology and renal letters. So again, I can click on this link, or I can click on the renal link, and it'll bring up that letter in a PDF file. And if you click on multiple letters, all of those letters will be visible in tabs on Adobe, so you can see them all and flick between them all at any one time. I may want to change that filter. I may also want to be able to see in outpatients, I may want to also add in radiology reports, which I can do from here, and I can save that as the same filter. So here I've got clinic letters and radiology reports. Again, the radiology reports created within Millennium are visible directly. The ones imported from outside require a link. But I also want to create a filter so I can just specifically see cardiology letters, because I think that would be useful. So I'm going to untick this and untick radiology, and I'm going to go down to a higher level of, or a more discrete level of the hierarchy. I'll just choose cardiology. I'll save that as cardiology letters, and I'd like to make this my default, so every time I go in it will automatically set to that. I'm going to apply that, and now when I go in I have just the 2 cardiology letters. I can still go back and see all outpatient letters and radiology, or everything that's available to me. So that's probably the best way, and it's worth setting that up to facilitate your outpatient clinics. It's just worth bearing in mind that these letters will only get into Millennium if your department has followed the proper process of dictation into CubeScribe, verifying and endorsing within CubeScribe. If you or your secretarial team, your administration team are correcting letters outside of CubeScribe and storing them in any other way, then they will not appear in Millennium. There is no mechanism for them to do so. So please ensure that you follow the appropriate process, and I hope that is useful.